You're feeling symptoms of low T, but getting treatment is far more than asking for a prescription. The biggest myth is that one low T blood test is your ticket. In reality, that's barely the first step. Eligibility requires a two-part key: confirmed low levels and significant clinical symptoms. You must have both. Before treatment, a screening process uncovers risks that could make TRT dangerous for you. We will walk you through the entire intake process, from documenting symptoms to understanding the red flags and long-term monitoring. So, where does it all begin? Not with a needle, but with a pen. Your doctor needs a detailed history of your symptoms: fatigue, brain fog, and low libido. Next, the blood draw, where timing is everything. It must be done early, between 8 and 10 a.m., when your testosterone is naturally highest. Fasting for 8 to 12 hours is often recommended. Glucose can influence testosterone readings, so follow your provider's instructions for accurate results. And one low test isn't enough. Medical guidelines demand 2 separate low readings on 2 different days to confirm clinical hypogonadism. But they don't just test for testosterone. Your first panel is a deep look into your entire endocrine system, checking pituitary hormones and estrogen levels. For men over 40, this includes a PSA test for prostate health. This is one of the first major safety checks, as TRT is contraindicated with active prostate cancer. Now, for a vital distinction. The number on a standard test is total testosterone. But most of it is not usable by your body. It's bound to a protein called SHBG. Why does this matter? A man can have normal total T, but high SHBG, leading to very low free T and all the symptoms. A doctor might miss the real problem. This is why a thorough evaluation requires a measurement of free testosterone. It provides the true picture of your hormonal status, beyond just the total T number. The evaluation also considers why your levels are low. Poor sleep, chronic stress, and obesity can all lower testosterone. Addressing these is often the first step. A distinction must be made between clinically diagnosed hypogonadism and the natural decline of T with age. TRT is approved for the former, not as a general anti-aging therapy. So you've documented symptoms and have 2 low tests. Are you automatically eligible? Not yet. Now we screen for contraindications, the absolute deal breakers. The biggest red flags are hormone-sensitive cancers. A history of prostate or breast cancer is an absolute contraindication for starting therapy. Serious cardiovascular issues are another major barrier. This includes a recent heart attack or stroke or severe, unstable congestive heart failure, a surprising but critical one: untreated obstructive sleep apnea. Testosterone can worsen OSA, so it must be managed before starting TRT. Finally, your blood itself can be a red flag. If your hematocrit, the concentration of red blood cells, is already too high, TRT is a no-go until that's resolved. Beyond safety red flags, there are life-altering side effects. The biggest one for younger men is fertility. TRT halts sperm production, causing temporary infertility. Because of this, any man who may want to have children in the future must be counseled on this risk. Options like sperm banking must be seriously discussed. Another complication is managing expectations. TRT is not a magic bullet. While some benefits appear in weeks, others, like muscle mass, can take 6 to 12 months. But what if you pass all these tests, understand the risks, and get approved? Is it smooth sailing from there? Does the process end? Part of the complexity is choosing the right administration method. Injections, gels, pellets, each has different dosing schedules, costs, and side effects. And there is no standard dose. Your starting amount is an educated guess. The real work begins after you start, with a process of careful adjustment. The intake process doesn't end at the first prescription. It transforms into a long-term monitoring protocol. This is a lifelong commitment to safety and efficacy. We asked if it was smooth sailing. The answer is no. It's about constant, careful navigation. Your doctor will schedule follow-up labs at 1, 3, and 6 months. And what are they monitoring? The very same things from your initial panel. They are watching your testosterone levels, but also rechecking your PSA and estradiol. Most importantly, they are monitoring your hematocrit. It was a red flag before starting, and it remains the biggest safety concern. If it rises, your dose will be lowered. So, who is eligible for TRT? It's not the man with one low number, it's the man with documented symptoms, multiple confirmed labs, and no major contraindications. The intake process is a multi-step filter designed for one thing: patient safety. It's a journey that proves TRT is a serious medical therapy, not a lifestyle supplement. Your role is to be honest about your symptoms, diligent with the protocols, and proactive in managing your lifestyle. Your health habits are a powerful partner to any treatment. If you're experiencing symptoms, don't guess. Seek out a qualified healthcare professional who follows these rigorous guidelines. A thorough evaluation is the first step.